Dr. Kulik, great to have you on the program. A big question we've been asking as parents: vaccines for kids. We know that Pfizer is in the midst of that trial. They're now asking for authorization use. Your thoughts here for that age group from 12 to 15?
Well, so far there's been one study. It has not been peer-reviewed and hasn't been published, but Pfizer did a study they released last week that showed that in 2,200 kids in the US, aged 12 to 15, that this vaccine was effective and safe in that no kids that received the vaccine developed COVID infection, but 18 people in the group that did not receive the vaccine, they received placebo, they did get COVID-19.
What do we need to be looking at more carefully here? Again, more research needing to be done. We know Pfizer is also running a trial for kids aged 6 months to 11 years. We already know that just getting a vaccine, regardless of age group, has been, unprecedented, during these, again, unprecedented times. So as a pediatrician, what are you looking for in a vaccine for kids?
Well, kids are not just little adults, as we say. Their immune systems are different, they're more robust. So the risk is that the same dose of vaccine could lead to more side effects in children. So we want to ascertain what is the best dose, what's the best dose frequency, and also does it keep them both safe, and also how effective is it? Kids, by and large, are not getting very sick with COVID, and this is an amazing, great thing. But they certainly can get infected, and they could pass it on to their loved ones. So for now, it's a public health measures to keep us safe, like masking and distancing, and maybe vaccines to come for young people as well.
What's your advice then to parents? As of course, we want to keep our kids safe, keeping them masked and distanced. But when we do get to that point, and we have seen, that sense of vaccine hesitancy, across the country, what would your advice be to parents who might be concerned about giving their kids a vaccine?
I think with more research, we'll have more education, more to teach them. I think when we're dealing with parents that are vaccine hesitant, which is so common nowadays, we want to speak less and listen more. I want to listen to these families and see what are their concerns, what are their worries about these vaccines, and then answer their questions to see what do they know, what do they want to know, and tell them both the pros and the potential side effects as well, being really open and honest with that, and providing all the education we have.
Considering the situation we're in right now, I know there's a lot of questions that are being asked about schools, the safety of schools for their kids. Teachers are also saying we need to get vaccinated. What is your take here, considering, when we look at the numbers that we've logged over the past 48 hours, well over 6,000 cases, tragically 39 more deaths. Your take here on, as you mentioned there, kids aren't getting as sick, but they are still getting sick. They can pass on the virus. Younger people are getting sick.
Yes, for sure. I think we need to be treating teachers like the other essential workers and people high risk like myself as a healthcare provider. All of our teachers need to be vaccinated. This should be a high priority because these adults that work in schools, not just teachers, but other educators, janitorial staff, everyone who works in a school is high risk because of the massive exposure to many people. That should be a huge priority. Let's put teachers, educators, people that work in schools first, as we are with healthcare providers as well.
Yeah, absolutely. From Toronto, pediatrician Dr. Dina Kulik. Doctor, always great to have you on the program. Thank you so much for this.
Thank you so much.